Everybody, how are you? All right, I'm doing it again. Scales. This is the last scales. Next week, we'll talk about something completely different. Okay, so I had to bring the scale up now because I just came across it and it was very appropriate concerning what we're talking about, which is sex. All right, so just bear with me because it's a little bit off the topic, but I want to bring it up because it's something that I see and I don't address it because I'm not a psychologist. This is where a psychologist or psychoanalyst can come into the picture. But I want to bring this up so that you know that this can affect you, and it does affect a lot of people because we're human, and depending on how we were brought up, genetics, etc., we probably all do this. All right, so this scale is called Sociably Desirable Response Scale. Okay. So in sex, right, we tend to want to be desirable. Across the board, we want to be desirable. We want to be liked. But how far do we take it? How far do you take it to be liked? Now, we all know someone that thinks they are it, right? They think that they are sort of like, I won't say perfect, but they want to portray themselves as perfect, right? So you're going to meet people like that. We're all going to bump into them. We have to know those that are doing this being sociably desirable. And we have to know within ourselves whether we're doing that. Okay. So this is where, when we're asked a question or when we are doing something, we are doing it or answering the question in a way that we appear to be favorably put, right? We're viewed favorably. We're put in a way that we are coming up on the top, right? Now, there are people that do that, will answer a question always as if they're always right or always perfect. That is what I mean by being sociably desirable. They're desiring to be accepted in society. And there they go, answering questions, doing things as if they've got it, they're on top of it, they're in charge, everything is perfect, picture perfect, and we're just, supposed to believe that everything in their world, there's nothing wrong in their world. We've all met them. But here's the problem. It does really affect you, not only in the bedroom, but again, in other walks of life. For example, in personal abilities, when you're trying to show someone that you can do something, you might do it in a way that they are like, oh boy, she's got this, right? And then when they do it, they don't. So it's almost like it's a contradiction to who they are. And you have to know if you do that. So I have a scale for that, right? Personalities. There are people's personalities that will walk around you and think they're one way because of the way they behave, the way they answer questions, the way they work, the way they interact with you. And you think their personality is one way, but what they're really doing is being sociably, again, desirable, answering and acting in a way that they are viewed as favorable, as uh, the top perfect person in the room to do the job or to be friends with, right? So you got to be careful. Are you guilty of doing that? And I know sexual behaviors, of course, we can do that, especially when you're meeting somebody new and you want to give your best foot forward, your first impression. You want to be able to let the person know that you're a decent person. So you might do that a little bit more than usual, be sociably desirable. We all do that. But there is an extreme. And the last category, of course, is drug users, drug abuse. Now, we all know about how they will do anything they want, say anything or do anything to get drugs. So you have to be aware of that also. That's a different category. Right now, I'm focusing on sexual behavior in the bedroom. Why? Because that's part of our communication. And if you're unable to be honest and not do the picture perfect person, yes, everything's okay, yes, everything's okay. No, you cannot do that because you're not going to be able to communicate to your partner what you need. Okay, so that's where I tell people you just want to do your best and be your best. You do not want to be perfect. All right? Excuse me. So, Alan Edwards came up with this in 1953, and his questionnaire had 34 questions, or I think 35, 39 questions. Mine, I just have 5. Okay, so there are newer ones, there are more modern ones, and this one is just 5. There is no right or wrong answer. All you have to know is, are you someone that's doing this consistently or just once in a while? Okay, that's the first you want to know. If you're doing this consistently, you definitely want to get help because you cannot live your life like that. You're going to disappoint not only the people around you, but yourself. So if you're a people pleaser, you can't say no. This is where you've got to get attention and get help. All right. Now, so this socially desirable response set was put together by Hayes and Hayashi and Stewart in 1989. The first question is, I am always courteous, even to people who are disagreeable. The Likert scale, which is what we're going to do, we've always been doing this, you go from 1, definitely true, 2, mostly true, 3, don't know, 4, mostly false, 5, definitely false. So you have 5 ranges here. I'll say it again. 1, definitely true. So to the answer, number 1, I'm always courteous even to people who are disagreeable. If you answer 1, you're saying that it's definitely true. Number 2, mostly true. Number 3, you don't know. Number 4, mostly false. Number 5, definitely false. And remember, there's no right or wrong. This is just being honest about who you are. Number 2, there have been occasions when I took advantage of someone else. Definitely true, mostly true, don't know, mostly false, definitely false. Now remember, there's no wrong or right answer here. We're just trying to figure out where are you in terms of trying to please people instead of being straight and honest, okay? And I'm not saying we're doing this on purpose. This is something that's subconscious. We're all trying to put our best foot forward. But when it comes to the bedroom sexually, we've got to make sure we are clear, crystal clear. Number 3, I sometimes try to get even rather than to forgive and forget. Definitely true, mostly true, don't know, mostly false, definitely false. Number 4, I sometimes feel resentful when I don't get my way. Definitely true, mostly true, don't know, mostly false, definitely false. And the 5th one, the last one, no matter who I'm talking to, I'm always a good listener. Definitely true, mostly true, don't know, mostly false, definitely false. The point of this is, as you can see, you don't want to be on the extremes of any of these questions. And if you are, like I said earlier, you really want to know so that you can say to yourself, I've got to stop doing this. And if you can't stop doing it, you get help. Because when you're communicating in that bedroom sexually or with anybody sociably, you really want to have that honest conversation so they know who you are and they can believe who you are and not suspect that you are not lying, but more pretending. So we know those pretenders and we try to avoid them sometimes. But are we a pretender? Do we unconsciously try to say that we are actually better than what we are? And I'll say the answer is yes, but I think the real harm is if it's consistent, especially in a very intimate relationship or a close relationship, even family members, right? We all, again, know people like that. So I wanted to just put that out there for you guys to realize that you have to know to be straightforward is the best way to go. To be honest is always the best way to go. if you, tilt it a little bit in one direction, sometimes fine. But if you do it all the time, it's going to be annoying. People are going to know that you're doing it and want to avoid you because it is not healthy to be with someone that cannot be honest most of the time. Okay? So this again is, remember, try not to be too perfect in the bedroom. You want to be natural. You want to be able to communicate with your partner, and you want him or her to know who the real you is. Okay? All right. Who is the real you? You want them to know who you are. Okay? All right. That was the sociably desirable one. Now, the anger one came up, the scales came up because I just bumped into it. And I wanted to talk about the scales of anger because we all have people that get angry in our life. And it's such a difficult uh, emotion to handle when someone gets angry. And angry in the bedroom, especially if they are having problems with the relationship, right? So if you're in a relationship where you're not happy, you can find that people are showing their anger more often than not. But what you want to do is sort of find out, is somebody angry and to what degree? And if they are, you want to know this even before you get into a relationship, right? So I came across this scale and I wanted you to just hear a few of the questions that they come up with because, again, these are psychologists that actually analyze this for a living. I am just trying to pull it to the sexual part because I want you to know before you get into a relationship with someone, get intimate and get close and get sexual, you want to assess their anger scale. You want to know, does this person blow their top or not? And it's not something that we're trained to do. This article came up with, or this questionnaire came into development by Dr. Ronald Porter and Dr. Patricia Efron, and they are the ones that developed 35 questions. It's called the BARQ, B-A-R-Q, Behavioral Anger Response Questionnaire. Okay? And they want to know whether you strongly agree, strongly disagree, that range to strongly disagree or strongly agree with their questions. And again, they have 35. I'm not going to read all 35. I'm going to just read some of them. Okay? The questions are designed to assess the person's anger response and behavior. Okay? Including how they express anger, how they perceive the consequences of their anger, how do they understand their anger, right? And you want to see, do they have insight into the fact that their anger is a particular level? So is your anger up here, in the middle, or down here? Do they even know where their anger is? Some people don't even realize they're very angry. Okay? And again, we can go into the childhood, we can get help for this. We already know that. But I'm saying sexually, before you get into a situation with somebody, you want to know, are you dealing with someone that's angry or are you angry? So here we go. I'm going to read out some questions. I'm not going to read all of them. I'm going to try my best not to read all of them, but I just felt that we need to know when we're with someone, does this person or is this person capable of getting angry to a point that our safety is at stake? All right, so direct anger out. They're put into categories, and I'm going to give you the categories, and we're going to just go from one to the other. So direct anger out. Number one, I say something nasty to the person who made me angry. Remember, you want to know, do you strongly agree or strongly disagree? That range, okay? You really have the option of going from like 1 to 5 in that range, okay? From strongly disagreeing to strongly agreeing, 5 points. So when someone says, I say something nasty to the person who made me angry, someone that does that, says something nasty when they're angry, you want to know, do you strongly agree? Do you strongly disagree? Where are you on that? Do you do that or do you don't? Or you don't? Number 2, I use strong gestures, for example, make a fist, wave my arms, or give a hand sign. when you're angry, right? Number 3, I swear or curse at the person who made me angry. So again, you want to know, where are you on this scale? I hit or push the person who made me angry. You want to know, do you strongly agree? Do you do this or do you not? Number 5, I express my anger by slamming a door or hitting something. You strongly agree to strongly disagree. Number 6, I shout. You strongly agree to strongly disagree. Next category, assertion. I wait until I am calm again and then talk to the person who made me angry. Do you do that? To what degree? I carefully think it over and then tell the person who made me angry how I feel. You want to know that degree. How often do you do that? Number 9, in a calm voice, I tell the person who made me angry how I honestly feel. Number 10, I try to understand what happened so that I can explain things to the person who made me angry. Number 11, I stay calm and I try to talk about the problem with the person who made me angry. Do you do that? Strongly agree? Or do you strongly disagree that you do that? Number 12, I leave the situation in order to calm down and then try to solve the problem. Okay? All right. Social support seeking is another category. I do not show my anger, but I talk about what happened with someone afterwards. So you're sort of seeking some social support. You don't want people to know how angry you get. So you're sort of deflecting it. So do you agree or disagree? Number 14, I leave the situation and look for someone who will agree with me. That's important. Number 15, I leave the situation, find someone to listen to my story, and ask for advice. Is that the sort of, answer? Do you agree to do that or do you disagree with that? Number 16, I think about the problem first and then talk about it with someone else. Number 17, I leave the situation and call a friend or a family member. Okay? Avoidance. We're going to the avoidance category. I tell myself what happened is not important when you're angry. You strongly agree or strongly disagree in that range. Number 26, I try to forget what happened. Number 27, I put what happened out of my mind. There are people that do that, just completely block it. What range? Strongly agree, strongly disagree. Number 28, I do not want to have to cause trouble, so I keep my feelings to myself and just want to feel better. Number 29, I just wait to feel better. Number 30, I try to keep busy so I can forget about what happened. Number 31, I keep thinking about what I wish I had done but didn't do. Rumination, this is a rumination category. Number 32, I find it hard to stop thinking about what happened. Number 33, I'm upset for a long time after this kind of situation. When I'm angry, I stay angry for a long time. You agree or disagree? Number 34, in my mind, I go over the situation that made me angry again, again, and again. So that's what you want to know in terms of anger. So they go on, and there is one category that they actually talk about: when I'm angry, I feel like crying. Do you agree or disagree? And the last question I want to say is it difficult? It is difficult not to cry when I am angry. It is difficult not to cry when I'm angry. So there are more, but I just wanted you to understand that there is a range of anger that you're going to be dealing with in your relationship. There's a range, right? You can see that. You can go from one end to the other. How extreme is that anger sexually? So you want to be able to know before you get into a relationship so that your communication is more free. Your communication is more successful so that your relationship will be more successful. So you want to be aware, are you in an angry situation with someone? where you have to sort of say, you know what, this is not healthy for me. I've got to bail or get help. It all depends on the degree and the severity. Of course, you know to get help if it's bad. But please understand, the reason why I'm bringing this up today is I wanted you to know two things. There is the sociably desirable response that people will do that you've got to be careful. For example, if someone says, how many partners have you had? How many sexual partners have you had? And they inflate it, or they, the men, of course, will give you high numbers. The women will give you lower numbers, right? That might be innocent. But if you keep on going on and on and on and find out that there's nothing that you can rely on in terms of an answer, you're dealing with someone that's not able to be honest. So there's a degree. Same thing with anger. There's a degree of anger. So where are you? Are you safe? And that is what you want to know if it pertains to you. If it pertains to your partner, you also want to know and make sure that you're not with someone that can put your life at risk. Okay, guys, I just had to mention that. Have a great weekend. I will see you next week. Take care. Bye.